Now to growing concerns about the deadly coronavirus officially hitting the U.S.
Worldwide now, the coronavirus taking a devastating toll.
Tonight, as the toll rises to staggering levels, reports the U.S. has surpassed China with over 80,000 since the start of the outbreak.
I want to be clear, the worst days are still ahead.
What a weird moment in time we're living in, an almost apocalyptic-like reality that none of us can quite grasp. You see, 2 or 3 weeks ago, I remember being in class, worrying about studying for my next midterm. I remember being able to go to sporting events. I even remember being able to buy toilet paper. But all that changed within the course of a couple weeks. The coronavirus went from being something that none of us were really worried about to being right in our backyards. And that's why I wanted to make this mini documentary. One, because I have plenty of free time at home, which I'm sure you all can relate to. And two, because these circumstances we find ourselves in are new to each and every one of us. The entire world is in uncharted waters, and I think that's a perfect phrase to describe our situation. None of us really know what we're doing. COVID-19 has affected almost every aspect of our daily lives. It has made our economy plummet, overwhelmed our healthcare systems, filled up our hospitals, and emptied public places. It has disrupted modern society on a scale never witnessed before, and it's barely the beginning. My goal of this video is to not only document these changes, but to inform people of how significant our situation really is. I've talked to a respiratory therapist, business owners, students, people of all ages, and I really want to get people to start taking this more seriously. But first, let's start at the beginning. Coronavirus, otherwise known as COVID-19. Originating from Wuhan, China, where scientists suspect the virus to have species jumped, from a bat to a pangolin to humans like you and me. The early symptoms are a fever, cough, and sore throat. The virus then makes its way into our lungs, where it causes breathing problems and sometimes even pneumonia. And with its 5-day incubation period, it's spreading like wildfire. Hand washing and social distancing were highly promoted to help slow the spread of COVID-19 and flatten the curve. But what is flattening the curve, you might ask? Around the world, we are seeing exponential growth of COVID-19 cases. Here in the US, as of today, April 7th, there are approximately 370,000 positive cases, when a week ago, there was only 130,000. You see, hand washing and social distancing aren't only to prevent you from getting infected, but to delay the pandemic, allowing for reduced peak stress on hospitals so they have the materials to treat each and every one of their patients rather than choosing who lives and who dies. And this is where it gets scary. Vital medical equipment like face masks and ventilators are already dwindling. Hospitals are becoming overflowed. Doctors, even nurses, are getting sick. According to Ed Young from The Atlantic, hospital beds will be full by late April. And by late June, for every available critical care bed, there will be 15 COVID patients in need of one. And this isn't even taking into account those that regularly need these critical care beds like stroke, heart attack, even car accident victims. By the end of the summer, worst case scenario, there will already be 2.2 million American deaths from COVID alone. What's happening in Spain and Italy can and probably will be our future. I talked to an exchange student from Italy to get some inside information.
I'm Matilde, I'm 17, I'm an exchange student, and I go to Ersinghaus school.
How has the coronavirus affected you?
It affected me a lot, firstly because the coronavirus was in Italy and I was here. It affected all my family and all my friends, and I was far away. And then it made my exchange year shorter. I had to go back, and I won't be able to say goodbye to everybody.
What do you think about the way Italy's handled it kind of compared to the US here? And I know for sure Italy has way more cases and stuff, but do you think people here should be taking it more seriously because it, hasn't fully hit us yet?
I think here you should take it more seriously because in Italy they made a mistake when they were saying, okay, there's the coronavirus, you have to stay home. No one stayed home. All the students said, okay, there's no school, we can hang out. So they all went around and they spread out the big virus. So all the old people, all the people that had like diseases like cancer, things like that, got sick. And they all had to go to the hospital because they needed help. There was no more space in the hospital. So a lot of people died because they couldn't get the help they needed because people didn't take it seriously.
Is there anything you kind of wanted to let people know who are going to watch this or like comment to people?
Please stay home and don't be selfish. Don't think only about yourselves, but think about all the people around you.
Mate explained this perfectly. We're each responsible for each other's health. I hate the mentality that most of my generation has about this entire situation. If I get sick, I'll be fine. Seniors and people with underlying health issues are the most vulnerable, but young people can still get life-threatening cases. So don't increase the odds of spreading this highly contagious disease to someone who will die from it just because you wanted to hang out with your friends. In fact, 50 to 70% of the entire world's population will get COVID-19. And this number is only going up because people aren't taking it seriously. So why are people being so selfish? Even if social distancing measures can reduce the rates of infection by 95%, 960,000 Americans will still need intensive care. And with that, there are only 180,000 respirators in the United States, with enough staff to only take care of 100,000 of those patients. So what now? I talked to my brother, who is a respiratory therapist in Houston, to get his thoughts on the situation.
My name's Joseph. Obviously, we share the same last name. I'm 31 years old, and I'm a respiratory therapist that lives in Houston, the world's largest medical center.
So can you explain your job and what you do and its importance in this COVID-19 pandemic?
So my job is simply to see to the physiological gas needs of people that are, not healthy. So a lot of diseases make people need more oxygen. A lot of diseases make people not able to get it in. But whether it's through physically breathing or, down in the level of their cells in their body, we just set up the equipment that, ensures that people can overcome those challenges. Whether it's wearing a mask that pressurizes the face or sticking a breathing tube into people's lungs, which is pretty much what they need to go straight to in the COVID-19 thing. So our job pretty much exists in the event that this would happen. Essentially, doctors and nurses don't have enough time to run ventilators. So we see to all the nitty-gritties and that part of the job, making sure that those tubes stay clear of snot and don't clog up. The New York governor is asking for more ventilators, but it's dude, you have no people to run these things. Essentially just have a bunch of empty machines, because those machines require equipment that changes from patient to patient.
Right now, how are the resources not only for the patients, but for you guys as well, like the masks you were saying?
Dude, finally our hospitals are feeling it. This week, actually just yesterday, I was issued a mask, and I was given that mask to wear all day long. That was the only one I was going to get. We've felt the supply shortages. We're essentially bracing for impact at this point, as hard as we can, because the numbers are saying some scary things to us, for sure. As of right now, we have 100,000 cases, a little bit more than that. If you reduce the exponential function back to the point in time, we were only at 1,000 cases. There was a point where if you had triplicated this far out, we would have said 100,000 cases. The scariest thing of today is that if you triplicate out another 2 weeks, if we've done a modestly good job of correcting and isolating, we're looking at 1 million cases in the entire United States. On the lower end, where we are being less effective, we're looking at 2 million cases. And if we get up to 2 million cases, it's anywhere from 4,000 to 8,000 deaths a day. That's literally a 9/11 every day in one of the most developed countries in the entire world. That's what we're looking at a probable minimum. We're starting to introduce a lot of really extreme measures that the Italians learned. It came out that over 50 Italian physicians had died we're not assuming we're immune to the same procedures that they did, because medically they are concurrent with our procedures. So we are having to learn from them and adopt their processes and plans. I'll give you an example. You'd never cut us dead in the medical field doing something like this until this, but essentially we have these big equipment bags that run over a ventilator, just various big pieces of equipment that we have to keep covered and dust-free. We're using those bags. We are literally throwing the entire patient body into a bag and draping it above their head so that we can do the things that access their airway and reduce our infection. We are adopting some pretty extreme measures to try and combat the spread of this. I would say that for now we have it pretty decently organized, but then again, before the storm, it always is organized, and the storm has not by any means hit yet.
Is there anything you kind of want to let people know who are going to watch this video?
I mean, the basic stuff, man. Stay away from the infected, which you should treat as literally everybody. Try to touch common surfaces the least. But, this is mainly a droplet, and we're suspecting an airborne transmission. So the whole contact thing is really not so much as dangerous as other infected people. Other infected people are going to get you infected like 1 million times faster than surfaces and, germophobia. That's not going to really protect you so much as just making smart decisions. We're going to be like number one, like frontline soldiers in this fight.
Healthcare workers, like my brother, are putting their lives on the line to help protect others. But right now, they're running out of resources to protect themselves. The United States runs on the assumption that when one state is overwhelmed, another will help it. But right now, all of our states are overwhelmed. All of the countries are running out of resources. We need to rapidly produce materials to give to these hospitals and their workers, but that's hard to do when places like China and Italy that were hit the hardest were major manufacturing centers for things like face masks and even nasal swabs for the COVID-19 test. We knew this pandemic was inevitable, so why weren't we prepared? I interviewed a senior in high school to learn about the effects this has already had on his future.
My name is Osaze Williams. I'm from Las Cruces, New Mexico, and I go to Las Cruces High School.
How has the coronavirus affected your senior year of high school?
Man, well, first off, I'm a track athlete. My entire track season, I predict, is over. That really affected my college visits. I had a visit to a D1 college, and it's postponed until further notice. Mm-hmm. So as of right now, I don't know what's going on with that. I don't know what's going to be done around it. Mm-hmm. I don't even, there's so many things that I just don't know, that I just need answers to.
It's your future.
Prom is important, but this is my future, like you said. Yeah. So I don't even know what to do at this point. Time is just what it is. I just got to keep training by myself. That's all I've been doing.
What do you feel about social distancing? Do you believe it's what you should be doing, it's what people should be doing, or what are your views on that?
The fact of it, the severity of this virus is that how contagious it is. Yeah. Some people might say, oh, it's a low percentage. It's a low percentage. If you have 100 Skittles, and I tell you that 3 of them or 2 of them can kill you, I know you're not going to eat those Skittles. You know what I mean? So that's something that's damn,
Yeah, so do you think our generation needs to be taking this more seriously, informing themselves with the wealth of internet availability that we have, you know what I mean?
I feel like a lot of the kids are not taking it seriously, but now that they're seeing, the NBA is shutting down, and schools are shutting, I think a few kids are taking it into consideration, but I saw something on Instagram, and it was these people in Miami, and they were just I just want to party and drink, and I'm damn, you're just increasing the risk for everyone around you, you know? So that is serious, and that's just dang, at least be considerate about the people who actually care.
Is there information you want to add, or anything you want to tell people?
Honestly, just take it serious. Just take it serious, because you don't want to be that person where something happens to you and you have a regret, because regrets are probably the worst thing in life, in my opinion. Just take it serious and protect the people around you, because you never know what can happen.
Here in Las Cruces, New Mexico, where we haven't been hit too hard yet, it's easy for people to minimize or even ignore the problem. In recent days, our governor has taken preventative measures by implementing a shelter in place. Public schools and all the activities that come along with it have been canceled for the time being. Businesses and restaurants only serve customers through curbside and delivery. Gyms across the country have closed, and each of these actions have their own individual problems. But let me put this into perspective for you. Daily life probably won't go back to normal until there's a vaccine. A vaccine that can take 12 to 18 months to be developed, and then even more time to manufacture it, ship it, and inject it. This will probably be the worst outbreak in the industrialized world. So what now? Will kids be homeschooled? Will business owners go bankrupt? I talked to a couple of business owners at the gym where I worked out to get their fears and views on the situation.
I'm Lacey Sherwood, owner of Peak Fitness here in Las Cruces, New Mexico.
And I'm Amber Jensen. I'm also a co-owner of Peak Fitness and a trainer and teacher there also.
How does the coronavirus, or how has it affected your business or job so far?
Well, obviously being a small gym, we've been closed down this whole week and we'll most likely be closed for weeks to come. We closed down Monday, and then after a few days later, there was the governor's orders to close down salons, gyms, those kind of things. So definitely it's impacted us that way.
Are you guys, and if you don't mind me asking, worried about money or, earning that wage, I guess?
I think it's a definite concern. Both my husband and I are not working right now, and so that means no income's coming in, but the bills and things are still due. Rent's due. Sorry. I don't mean to get emotional, but it does get scary.
Yeah, absolutely. Just to kind of echo what Amber said, it's, we're a very small business, and we personally, as owners and teachers, haven't, been taking pay because we're a very small business, and so that's definitely, definitely affects the gym as a whole.
Do you guys have advice or how people can stay healthy, both physically and mentally at home without going out and going to places, going to movies, or being able to work out in the gym,
We are a very social human race, I think that it's important to have that, and so we're really blessed with technology. We're able to have this via technology right now, which is awesome. But I do think that moving your body somehow, some way, every day is not only good and important for your physical health, but your mental health. And we're really blessed that there's a lot of companies, a lot of fitness companies and health companies that are doing a lot of free online stuff right now. So you can, bring those workouts home, do whatever you can, go for hikes with your kids, go for walks.
And I think the key for me is getting outside. I have to get out and I have to get some fresh air for my mental state. We went out and, as a family, took the dogs for a walk today, just kind of out in the desert, and even if you don't do something like that, just getting outside in the backyard and just breathing some fresh air for a little while is very healthy for me.
Do you guys have any comments or anything you would like to tell anyone who would watch this little documentary?
I've seen a lot of posts on social media and things about supporting local small businesses, things in ways that you can help, and we have a great community of members. We've had people reach out, offering to continue to pay for their personal training, or can we do some virtual training and things like that. The community has been awesome. I would say just continue to support your local businesses as best you can.
While still staying home as much as you can.
Yeah.
One of my kids has a compromised immune system, so I'm taking the staying at home pretty seriously. But like Lacey said, there's been a lot of curbside. I've seen things all over Facebook about people doing curbside and, whatever they can, like she said. So we're definitely trying to do our part.
Like Lacey and Amber were saying, we should be supporting our local businesses while also still practicing social distancing. Get curbside delivery. You can even offer cash advances to businesses that need that new cash flow, like hairdressers or gyms. But there is still a ton of gray area or middle ground on how to work through these unique situations we find ourselves in. School, work, even travel policies need to and probably will change. I also believe that as soon as infection rates begin to go down, there will be a secondary health pandemic of mental health problems to follow. We're already even seeing more domestic violence problems. This pandemic and its effects are completely new to our modern world. It has imprinted itself on our nation's psyche, and it will catalyze social change. I wanted to talk to someone about the situation who's had a more experienced lifetime than me.
My name is Carol Grady. I was born around 1940, right after Christmas. I work in lots of different fields. Right now I'm in mental health. I've seen a lot, and I've been around a long time.
I guess this is kind of a new situation to the entire world rather than, just America or certain parts.
Exactly. But I mean, the globe, it's a global pandemic. That's how they refer to it. And I don't think anything's ever happened like that in this war or in the world. I don't think anything has been this threatening that has moved this fast. It required us to get as many resources together as we have to get now. But I have high hopes that we're going to survive this and that people will be closer together and understand that more humanity will be brought to the surface. People will be better with each other after it's over. Whoever survives. I hate to say that, but that's true. There might be high mortality rates, and we have to get ready to be able to grieve as well as fear. And sometimes we're going to have to grieve the loss of our old normal while we're adapting to the new normal. That's something we have to grieve, the loss of the freedoms of going out in the street or going to the store or shaking hands or hugging people. We can't do it.
Instead of it being, a world war, it's a world pandemic, and it's not people we're fighting, but kind of a virus, that affects all of us equally.
Absolutely. We're at war against the virus, but we have to remember to keep our mental health, no matter whether we stay well or sick or what. If we crater and we just collapse under the stress of it's not going to help anybody. None of us will be helped, and none of us we'll all be hurt. Mm-hmm. Unless we band together.
I've realized this situation has forced the world to reevaluate our policies and systems. This is an unprecedented time with extraordinary circumstances. Thank your essential workers, the people who are risking their lives to help keep America running. Your sanitation workers, mail lady, mailmen, delivery truck guys, healthcare workers, grocery store clerks, and your fast food workers. Thank your teachers and principals who are adapting to help students continue their learning processes remotely. I believe the entire world will come out of this pandemic with changed mentalities and open hearts, with the potential to rebuild a changed world. I wanted to end this video on a high note. You see, every situation has its pros and cons. Rather than focusing on the negative, why not see the silver lining? Every person I interviewed, I'd also asked, what is the silver lining to this situation? Here's what they said.
People will begin to make the most of every moment.
Being able to be home and spend time with the family.
Progressing the way we use medicine. Use this as an opportunity to make our system better as a nation.
More humanity will be brought to the surface. People will be better with each other after it's over.
This has kind of forced everybody to slow down and focus on what's most important and focus on what really matters in your life. And there's definitely blessings there for sure.
And the people stayed home and read books and listened and rested and exercised and made art and played games and learned new ways of being and were still and listened more deeply. Some meditated, some prayed, some danced, some met their shadows. And the people began to think differently, and the people healed. And in the absence of people living in ignorant, dangerous, mindless, and heartless ways, the earth began to heal. And when the danger had passed, and the people joined together again, they grieved their losses and made new choices, and dreamed new images, and created new ways to live and heal the earth fully, as they had been healed. A poem by Kitty O'Mara.